Rotary is such an amazing organisation, been to so many events, hearing about all the different projects involved, and we live in kind of very troubled times when you hear about the polio eradication campaign, and you can see actually something where an organisation has made such a profound difference in the world and is so close. It's incredibly inspiring. So with that in mind, it's a great honour to be able to talk to you about BiPolar and the partnership that we've got with Rotary GB in Ireland. So BiPolar is probably the most common severe mental illness in the world. So it's classed as a mood disorder, and those of you who've probably heard of it, but you're probably not overly familiar about what it is, and don't worry, there's no such thing as silly questions here. So what I've got left in front of you is a mood disorder scale, which gives people a little language to talk about people's moods. So those of you who aren't living with bipolar, which is myself and many people, the best possible day. So maybe you've just found out that you finally eradicated polio. You're probably never going to experience more than a 6 in terms of like elation, mood and energy. Maybe your worst possible day, it's been a very long committee meeting perhaps, and you haven't quite got the project going that you wanted to just yet. Maybe it's a kind of very down day, you probably experience a 4. Though for people living with bipolar, they have a much bigger range of emotions, so they can experience what's called hypermania, where people can have huge amounts of energy, where they can be very productive, very talkative, and maybe you can go out, spend quite a bit of money. But then without the right support, that high mood can quickly get out of control. And people can experience what's called mania or manic episodes, where they can have huge amounts of energy, they don't sleep for 3 or 4 days at a time, they experience hypersexual behaviour, they go and spend their life savings, they can experience then kind of psychotic delusions as well. And then they end up being sectioned. So about half the people living with bipolar have been sectioned at some point, which is a really awful, dramatic experience. The other end of the story is also around the deep depressions as well. People living with bipolar can experience really dark depressions that can last for weeks, months at a time, recurring suicidal thoughts. And having bipolar increases the risk of suicide by 20 times the national average. So we estimate that about 1 in 5 people with bipolar will eventually take their own life. It's a really difficult condition to be able to live with. It's made even more difficult because it's such a common condition. There's 1 in 50 adults living with it. So that's 1 over 1 million people in the UK itself, and less than half of them have an actual diagnosis, so they don't even know that they've got the condition. And it affects everyone regardless of their background and ethnicity. It's pretty much equally affected all across the world. There's millions of people living with bipolar in India, living in America, in China, all across the world. Wherever there's Rotarians, there's going to be people living with bipolar. And one of the great tragedies is actually, with the right care and support, it's never easy living with bipolar, but it is possible to live a good life and to be able to mitigate some of the really kind of horrendous symptoms associated with it. A lot of the changes that people need as well are changes that are really necessarily cost a lot of money to be able to implement. So about a third of people with bipolar respond really well to a treatment called lithium, which is it's a generic treatment, it's incredibly cheap, it's available all across the world. That reduces the risk of suicide down to the national average, but also making really practical changes in someone's life to reduce the stress factors. So big triggers for bipolar can be around loss of sleep. If you're not sleeping properly, it can be a big symptom and a trigger. Having issues to do with travel as well. If you're travelling around because your sleep patterns are disrupted, issues with time zones, that can be a big trigger. Stress can be a big trigger. Moving house, starting a new job, going to university. All of these things are things that people with bipolar should and do, but why getting people a diagnosis and helping them, it allows people to plan their lives in a way that they don't do them all at once like I did. When I started a new job, got married and had a honeymoon all in the space of a couple of weeks, which was quite stressful and enjoyable, but I would never have done that if I'd known I had bipolar. I would have done it more space than that at the time. So what's a great privilege to be here in terms of talking about our partnership is, it's to be able to raise awareness of what bipolar is, and to be able to use this amazing community of support that Rotarians have across the world to be able to improve understanding of bipolar and to be able to get more people to be able to get a diagnosis of the condition. So what we've been doing is working with District 1145 and hopefully with the London District. Well, I don't know what number is it. 1130. 1130. Everyone knows the district they're part of. Is to be able to raise awareness of the condition It's World Bipolar Day on the 30th of March, so what we're trying to do is to get street stalls all across the country to have conversations about bipolar and mood and mental health as well, which is really critical, and to make people confident to be able to combat some of the stigma that's attached to bipolar. So we've got banners which have the mood scale on it, so we're hoping to have Rotarians to be able to go out there and have conversations with the local community, and to be able to signpost them to people to support as well, because that's really critical. That if you're going to open up a conversation with people about something that could potentially be really life-changing for them, that you're able to do that in a constructive way that enables them to then go and get support and to be able to try to get a diagnosis or help for their loved ones as well. So any Rotarians here from clubs who are interested in doing street stall around about the 30th of March, we're really glad to hear from you. Also, if you just want to find out a bit more about bipolar, we've got this amazing e-club. We're trying to get speakers from all across the world. It's an e-club, so it doesn't matter where you are. We meet on a Tuesday evening, the second Tuesday, fourth Tuesday of the month. Anyway, we've got one tomorrow night, so I think that's the fourth Tuesday, and then the second Tuesday lunchtime. So a Tuesday lunchtime and a Tuesday evening. Again, we don't want to take anyone away from their existing Rotarian clubs, but it's just, I know that people like to go to each other's events. So if you do want to dial in and to be able to hear from some really amazing international speakers, do join us. We're going to hear from the US General, who was I think 2-star General of the US Army, lived with bipolar for a number of years. That bipolar helped him actually do very well, because he's very productive with hypomanic episodes, but then it kind of got out of control. He got a diagnosis, and then the next day the army told him basically you can either resign or we're going to give you the sack. It's quite a very brutal way to kind of hear about a diagnosis, but that said, he was actually able to get a lot of support from the Veterans Association, and has been able to rebuild his life in terms of being a really powerful advocate for and giving advice and guidance to help people manage the condition. We're going to also hear from Bipolar France, obviously the Rotarians in France, talking about the experience of the French healthcare system, which is often a lot better in many respects than in the UK. It's absolutely horrendous that it takes 9.5 years to get a diagnosis in the UK, 9.4 years in England, and as Eve said, it's even longer in Wales, almost over 11 years. And some of the shocking stories we're hearing at the moment from the NHS, this is maybe something that Stephen might want to take up, is that at the moment, the only way that they will diagnose people with bipolar is if someone's actually suicidal. That people are being referred by their GPs, so the GPs are picking people up in primary care, people are going with the symptoms, and then they're getting referred on to secondary care, and the psychiatrist saying that, I'm sorry, we can't diagnose, we don't have capacity, unless they're suicidal, which is totally devastating, because if you get the treatment and the support, it dramatically reduces the risk of suicide. So it's a bit like being told that you can only get a diagnosed cancer if you're literally on death's doors. I mean, that is a truly horrendous way. So there's loads of things that the NHS needs to do better to be able to support people with bipolar. And a diagnosis is not expensive. It requires often a 45-minute session with a psychiatrist to be able to do it. So we're not asking for the will to, we're asking for very practical solutions. So, and that's something maybe, Stephen, if you might want to have a conversation about. But in terms of what you can do as Rotarian, just raise awareness in your community. Lots of stuff that can be done, lots of great work in London about prevention as well, helping people who are pre-diagnosis to be able to help manage the condition better before they're able to get that support, and the medication makes such a massive difference. We're also going to be hearing from Vijay, who's the Chief Executive of Bipolar India, to see some really interesting examples of how India is managing it. And we want to hear from Rotarians as well across the world, who are psychiatrists and so forth. So that's our e-club. Love to hear any questions you might have about the condition and how we're going forward.
2 questions.
Yeah.
So I was just looking at some of the symptoms here. With regards to women in their adult lives or reaching that perimenopausal or menopausal state of their life, how would you know, I mean, difficult question. If I look at this, I've worked with lots of people of that age group, and they seem to have some of this. Will they be diagnosed as bipolar or just that change of life, you know?
Only a psychiatrist could do that assessment, but there will definitely be, can be a major trigger. So we did as part of our research, we did a big survey of women living with bipolar, and that did actually identify that hormonal changes in menopause and perimenopause was a big trigger for a number of women. So there will be women who are definitely having their first manic and depressive episodes while they're going through the menopause. So there's kind of women's mental health is obviously a big area that needs a lot more priorities as well. And so understanding the menopause is something where there needs to be a lot more research, but we certainly identify that as being a big risk factor for women. It affects men and women evenly over the lifetime, but it tends to be women tend to maybe develop it slightly more in middle age. But we did this really amazing woman called Dr. Claire Dolman, who's wrote part of our report